Hi, my name is Jackie and I am a Dermatology Advanced Practitioner. You may see me when you attend the acne clinic. This video is to help inform you about the medication Isotretinoin. This is also known as Roaccutane or Accutane. This is the most common medication we use in patients with severe acne who have failed to respond to first-line treatments. Isotretinoin is a vitamin A derivative, which works by reducing sebum production, limiting the buildup of dead cells, inhibiting the growth of acne-causing bacteria, and inflammation. If you do start on this medication, please do not take any vitamin A supplements during treatment, as these can be found in a range of products such as protein powders, multivitamins, supplements and topical creams, so take care to ensure that the products you use do not contain these. It is a medication that most patients will take for many months, and it is not something that will work straight away. On average, it takes between 20 to 24 weeks, but this is dependent on the dose that you take and how well you tolerate the side effects. This medication can produce fantastic results for acne, but as with all medications, there are side effects that you should be aware of. Most commonly, patients will experience dry lips, dry skin and dry eyes, so we would recommend that you use a lip balm for the lips, an oil-free moisturiser for your skin and lubricating eye drops if needed. These can all be purchased over the counter. Sometimes your nose can get dry too, which may lead to nosebleeds. We would recommend applying a bit of moisturiser into the nose twice a day. This is what we want the medication to do, to dry your skin out and dry your spots out. It is a good sign that the medication is doing its job. Your skin can also be more sensitive to the sun, so we would recommend that you use a high-factor sun cream with a 5-star UVB rating so that you don't burn. You may notice some muscle aches and pains, especially if you are sporty. Isotretinoin can affect your night vision, and although this is rare, it is irreversible, so it is important to let us know if you are considering a career that would rely on this, such as being a pilot. If you were to experience severe headaches that stopped you from doing your normal day-to-day activities, we would want to know, so please get in touch with us. Your skin will be a lot more fragile whilst on isotretinoin, and therefore you should avoid anything that is going to traumatise the skin. Activities such as threading, waxing, tooth whitening and laser hair removal can all be abrasive to the skin and should be avoided whilst on treatment and for up to 6 months afterwards. At each of your appointments, we will check in with you to see how you are getting on and if you are experiencing any side effects. It is important for you to be open and honest with the team so that we can help you feel more comfortable throughout your treatment. One thing to note is that isotretinoin may increase the fats in the blood. These are called cholesterol, and they may have some effect on the enzymes in your liver. Although incredibly rare, we take regular blood tests to monitor these levels before treatment and throughout to ensure that they remain stable. We advise you to limit your alcohol intake throughout treatment. There is quite a lot of traction online and in the media about isotretinoin and its association with mental health problems. It has not yet been established whether isotretinoin definitely causes mood disturbance, but it is important that we take this seriously. There are some reported experiences of worsening mood or changes in behaviour, including anxiety, low mood, depression, agitation, aggression towards others, or a loss of contact with reality called psychosis. Rarely are there been reports of people who have self-harmed or who have taken their own life whilst on isotretinoin. It is important to have a good support network around you who can also help monitor your mood, and we will also do this when we're in clinic. In October 2023, the MHRA published some guidance for healthcare professionals prescribing isotretinoin, and we are adopting these guidelines in our clinic. We know that people with acne are more likely to have anxiety and depression than those without. Acne is visible and difficult to hide. As such, this can affect people's self-confidence and can make people conscious about their appearance. It is also important to know that there are several studies that have shown people's mood improves after completing a course of isotretinoin. More recently, there have also been reports of sexual dysfunction, which have occurred during and following treatment. Symptoms have included reduced libido, erectile dysfunction, and reduced genital sensation. The evidence around this is sparse. We know that sexual function problems can be related to mental health issues or other medications such as antidepressants. As I mentioned earlier, it is important to let us know if you are experiencing any of these symptoms. For any person of childbearing potential, you are considered to have a childbearing potential if you have a uterus and at least one ovary, unless you have undergone surgical sterilisation or you are postmenopausal, both of which must be confirmed by a healthcare professional. Isotretinoin may cause serious harm to the development of a baby. It is a tetragenic medication, meaning it causes severe birth defects. It also increases the risk of miscarriage. You should avoid pregnancy during isotretinoin treatment and for 1 month after stopping. There is no evidence that suggests that isotretinoin affects fertility, but it is advised not to fall pregnant until at least 1 month after you have stopped isotretinoin to prevent any additional risk to the unborn baby. The use of contraception is strongly recommended in those with childbearing potential. These can include a hormonal contraceptive pill or contraceptive injection plus a barrier method, for example, a condom, female condom, vaginal cap. Alternatively, the hormonal or copper coil or the contraceptive implant are considered highly effective forms of contraception. At your initial appointment, you will complete an acknowledgement of risk form with your prescriber, which includes the pregnancy prevention programme. The acknowledgement of risk form is a legal document, so please read it carefully, and if in agreement, you will sign this to say that you accept the risks and side effects associated with isotretinoin, and you will be given a copy of this for your own records. For most people that we meet in clinic and treat with this medication, it is life-changing, but it is important for you to know exactly what it is you will be taking, including the potential side effects. Please take some time to consider these and ask any questions you may have at your first appointment. Please do re-watch the videos if needed and take the time to read the written information we will be sending you as well before your appointment.